Here to talk about, you guessed it, running. Eden?
Thank you, Rand. Speaking of running, whether you're signed up for the Gate River Run or you've been hitting that new home gym you got during COVID, or maybe you're just sore from hunching over a computer, aches and pains are a part of our life right now. And John Kovacs and Lizzie Cooper from H2 Health are with us right now to talk about the great service that is right here all over Jacksonville now. And John, let's start with you. What is H2 Health?
So we are an outpatient physical therapy company, formerly known in Jacksonville and through the country as Heartland Rehab Services. So as of February 2020, we actually changed it, a name rebranding, and we're just growing and moving to different parts of the community. But right now we have 21 clinics in this Jacksonville market, so every corner to make convenience for the individual. But we treat a lot of the active running population, but all ages, size, and shapes.
Yeah, there are a lot of people who seek physical therapy treatments, not just after an injury too, but just for those aches and pains. And Lizzie, let's talk to you about kind of the common diagnoses that you
Right. So, we treat, like John alluded to, a variety of musculoskeletal and neurological conditions. I'd say the most common things that we see in the clinic are, your typical low back pain, cervical spine pain, shoulders. Like you mentioned, sitting at a desk a lot causes a lot of postural strain. And then also, as it pertains to the more active population, we treat a lot of overuse injuries. So if you are a runner or a CrossFitter, that kind of thing, developing tendinopathies, your plantar fasciitis, your patellar tendonitis, IT band syndrome, those are a little bit more typical of the active population.
Let's talk about what you're holding in your hand right now. I know that as a runner, as a STEM, and I know that you physical therapists are artists and magicians and scientists with these things. Can you explain a little bit about that and maybe cupping as well?
Yeah, of course. So the ASTEM program, ASTEM is essentially a soft tissue technique that uses instruments to help to promote healing. So when a muscle undergoes an injury, portions of the muscle fiber undergo microtrauma, right? So instead of laying down a nice parallel fashion, they become bundled or scarred and adhese. We use the instruments to glide along the tissues, and the instruments catch on those areas of adhesion and they tell the body, hey, start cleaning up this area again, start healing it again. So it's a really good technique for some of those pesky injuries that have been lingering for weeks, for months, and it seems like the body's not doing a great way of healing. The instruments help to create a little bit of active inflammation, which is the first stage of healing, to really kickstart things and get them going again.
And then I know that a lot of us, I think it was Michael Phelps that introduced the world of cupping when we would see him with those big cups all over him, those marks, those circles. Is that kind of that same principle of just trying to get the blood working and everything stimulated there?
Very similar, and thank you, Michael, for that. But essentially, cupping works in a reverse way. So instead of putting pressure on the trigger point or on the muscle, it helps to lift the skin and lift the fascia, which helps oxygen get to the tissues. And as we know, oxygen promotes healing. So it can be used at the same time or in the same treatment session with ASTEM, but works in a little bit different of a fashion, and it can target more trigger point areas versus a widespread area.
So let's say somebody watching right now is experiencing some aches and pains, and maybe they're like, well, it's not exactly an injury, but man, I just haven't felt good in a while. This hurts, that hurts. Can you talk a little bit about where your locations are, and then also how someone can reach out to you, your website, phone number, that kind of thing?
Sure. No, we have 20 clinics in the Jacksonville area. We're opening actually in McClenny next month. But the trick is just to if you've got a problem that's chronic and it continues to be problematic, have a physical therapist take a look at it. I mean, I had a physical therapist not long ago tell me they're movement specialists, and I think that really makes sense.
I would agree with that.
If you've got that injury or that chronic overuse that just continues to bother and is not going away, it's probably a great opportunity to come in and have somebody look at it.
And in Florida, you can see a physical therapist for 30 days without a script from your doctor. So you're welcome to call any of our clinics, speak to our patient coordinators, and they can get you set up with a PT and kind of cut out the middleman of going to the doctor if you are, sure that it is more of just a musculoskeletal type of injury.
So make that phone call. We're going to give you the number. It's 800-699-9395 or h2health.com. And if you're watching the show, then you can actually set up for complimentary diagnosis to see what the procedures are going to be to get you moving in the right direction. Please come back because people are starting to get more active, so we need to see and talk to you guys more, okay?
Love it.
So we'd love to have you back.
Thank
We're
you.
going to be right back with more River City Live.
Ashley Home Store's President's Day Mattress Marathon Sale is now extended. Get 0%